Om Sahana Vavatu Sahano Bhunaktu Sahaviryam Karvavahai Tejasvinavadhitamastu Ma Vidvishavahai. Om Shanti Shanti Shanti. Yogena Chityasya Padena Vacham Alam Sarirasya Chavadakena Yopakarottam Prabhoram Muninam Patanjalina Pranajalirana Tasmi. Om Shanti Shanti Shanti. Here we found when it's little warm, gently attach your ball. अच्छा, आज के लिए कुछ होमवर्क था?
Yes, we have some presentations to do.
Okay. Go ahead. Who will be the first? Ritu, are you ready?
One slide is still pending.
Okay.
Related to food.
Okay. Trisha? Ready. Okay, go ahead. Ritu will go for your presentation also. Do not need to worry. So, and Anam, Rajeshi, Arundhati, all you have to be ready. So after her presentation, we'll move forward.
So mine is incomplete, sir. I have another.
No problem. No. Go for incomplete only.
So how to share it?
Okay, I am giving you the option. Yes. Now you can share. Just there is share screen option is there.
Where? This option.
Okay. Wait. Then there is share screen, and then which screen you are willing to share. That first open the PPT.
PPT, Microsoft share.
No. PPT को पहले खोलना है.
Okay, sir.
वो पहले खोल लो स्क्रीन में.
Yes.
Now go to share screen. And whichever you are willing to share, the difference. Yes.
1 second.
Make it full screen. Yes, custom from beginning.
দেখা যাচ্ছে?
Yes, clearly. Continue.
Yogic management of PCOD and PCOS. So how to start? Just I'm gonna read.
Yes, read it and don't read it just like you are studying something. You just try to make us understand. Okay, whatever you are saying. Okay? That will be good.
PCOD, polycystic ovarian disease, and PCOS is a medical condition in women where the ovaries produce multiple immature eggs, which over time become cysts on the ovaries. PCOD and PCOS is a hormonal disease in women which leads to irregular menstrual cycles. If one is to observe an ultrasound of the lower abdomen of a woman, one may be able to observe a series of abnormally large eggs which look like strings of pearls. PCOS may be caused due to a lot of reasons, including genetic. Even though this disease has been steadily on the rise in the past few years, it was first recognized by physician Antonio Vallisneri in 1721 in Italy. Further depiction of PCOS are found in 1844, followed by a specific diagnosis and naming of the disease in 1935 by Irving F. Stimpson and Michel N. Leventhal. This disease was originally known as Stein-Leventhal syndrome. Polycystic ovary syndrome or polycystic ovary disorder is a hormonal and metabolic disease. It is caused when a female's body is not able to complete its monthly ovulation process. Women suffering from PCOS have less than 8 menstruation periods in a year. The cysts observed on the lining of the ovaries are actually immature eggs that have not matured enough to be ejected out of the body and hence are stuck on the ovary walls. This leads to an imbalance in the hormone levels of the body, leading to the rise of the androgen levels. These hormones lead to body hair in unwanted places, weight gain, hair loss, and other problems. It is the most common health issue women face today. Nearly 2% to 40% of women within the range of 12 years to 45 years face this issue world over. The range and frequency of the problem make it a difficult one to tackle. Not to mention, no one really knows why a woman develops PCOD. While obesity is named as a cause that causes the symptoms, not every obese woman suffers from PCOS. The next is the common symptoms of PCOD or PCOS. The preliminary signs and symptoms of PCOD usually develop during the first cycle of menstruations at puberty. PCOD may also develop later due to increased weight over the years. There are various symptoms of PCOD. Some of the common signs are
Yes, it's visible. Trisha,
না স্যার আমি সাইড পোর্শনটা না দেখতে পাচ্ছি না আমার নিজের স্ক্রিনে ওকে
do one thing, just stop the screen share and then again screen share. Stop sharing. एकदम ऊपर view option.
না না স্টপ শেয়ারিং না স্যার আচ্ছা এইগুলো কি করে বন্ধ করব স্যার
কোনগুলো?
এই যে মানে আমাদেরকে যে দেখা যাচ্ছে না এই সাইড পোরশনটা কি করে বন্ধ করব
But we can see you completely. Okay. Now again screen share.
Yes, okay, हाँ. Increase.
No, screen share करना है. Screen share करना है.
Sorry.
Share screen and then এটা ওই তোমার পিপিটিটা খুলে রাখো, দিয়ে আবার নতুন করে এই জুমে গিয়ে দেন এগেন শেয়ার দ্য স্ক্রিন।
কি হলো আমি কিছু বুঝতে পারছি।
ना ना ना, जस्ट डू वन थिंग ना, जस्ट वो क्या बोलते हैं, पीपीटी के ऊपर जाओ, एस्केप जो बटन है वो बटन क्लिक करो उसमें जाके, क्योंकि वो पूरा फुल स्क्रीन हुआ है ना, एस्केप बटन क्लिक करो, या एंड स्लाइड शो करो पहले, फिर से ओपन करो वो।
हम्म,
अच्छा, डू यू हैव एनी डेस्क कैप? एनी डेस्क कैप इज
ওকে
देयर?
ডান স্যার, 1 মিনিট হয়ে গেছে।
यस। अच्छा, जिस में जा रहे हो उसमें जाके एकदम नीचे नीचे राइट नीचे जाओ, वो जो जहाँ पे जूम इन जूम आउट है ना, वहां पे देखो एक वो कप वाला साइन है, नीचे नीचे नीचे, वो छोड़ दो, उसको छोड़ दो, नीचे नीचे जाओ, ये जो
কোথায়?
कप वाला साइन है, नोट्स नोट्स के बगल में देखो एक कप वाला साइन है ना,
হ্যাঁ।
हाँ उसमें क्लिक करो।
হুম। হ্যাঁ স্যার, কিন্তু প্রবলেমটা হচ্ছে আমি নিজের লেখাটা দেখতে পাচ্ছি না।
बट योर वॉइस इज नॉट कमिंग, से समथिंग।
স্যার, am I audible?
सुनाई दे रहा है तीसरा का आवाज?
Yes, sir.
ओके, ठीक है, कंटिन्यू। कंटिन्यू तीसरा।
হ্যাঁ, এবার ঠিক আছে। First line. Increased androgen levels, excess male sex hormones may result in various physical manifestations such as excess facial and body hair and male pattern baldness. Irregular periods or delayed menstrual cycle due to the abnormality in menstruations of the eggs. Difficulty in getting pregnant due to irregular and delayed or failed ovulations. The hormone imbalance in the body prevent follicles from maturing and releasing the eggs, causing delayed or failed ovulation. This heavily affects the menstrual cycle and thereby periods. Next is hair loss or excessive thinning of hair. This symptom too is due to the increased production of male hormones in the body, acne on the skin, and weight gain. Types of PCOS or PCOD. As established before, PCOS is a relatively new field of study, which means that there is still a lot of ambiguity attached to it. PCOS has been broadly divided into 2 types: insulin-resistant PCOS. Insulin-resistant or type 1 PCOS is generally associated with all the classical signs of PCOS, which include obesity, facial hair, hair loss, and acne caused by higher levels of male hormones in the bloodstream. This type of PCOS is indicated by the body's inability to process blood sugar, which leads to its storage as fat. Patients with type 1 PCOS are at risk of developing type 2 diabetes and heart disease. Such patients are generally advised to go on a diet and lose weight. However, it should be kept in mind that weight loss for such patients is not easy. Along with weight loss, patients may also be given supplements to control blood sugar. Then the next type is non-insulin resistant PCOS. Non-insulin resistant or type 2 PCOS is a situation when a patient does not show any signs of insulin resistance and yet suffers from PCOS. Non-insulin PCOS is caused by other reasons like adrenal stress, thyroid, vitamin D or iodine deficiency, and so on. The treatment for type 2 PCOS focuses more on healing the body naturally, which includes more rhythmic and relaxing exercises. Cause and risk factors. Family history. There is a 50% possibility of getting PCOD among the women whose immediate female relatives suffer from PCOD. As they grow older, this PCOD may lead to type 2 diabetes, as a PCOD is a risk factor for developing diabetes. Till now, a single gene has not yet found to be the cause of PCOD, and it is likely to be complex and involve multiple genes. Next is insulin resistance and lifestyle. About 70% women with PCOD have peripheral insulin resistance. The pancreas produces insulin, which is a hormone to help the body use sugar from foods for energy. Due to insulin resistance, the cell can't use insulin properly and the body's demand for insulin increases. To compensate, the pancreas make more insulin. Factors of insulin resistance is insulin resistance as a result of genetic factors, insulin result as a result of being overweight related to diet and inactivity, or a combination of both these two factors. Next is inflammation. PCOS can lead to increased levels of inflammation in women, and being overweight also can contribute to inflammations. Studies have shown in PCOD that excess inflammation is linked to higher androgen levels. Next is weight. Sometimes a higher weight may worsen insulin resistance and the symptoms of polycystic ovarian syndrome. Some women with PCOD report that they had never experienced symptoms such as menstrual irregularity or excessive hair growth and a healthy weight. However, these symptoms only appear once they gain weight. Causes and risk factors. PCOS can cause other chronic disease. Here are some common chronic disease caused by PCOS. Diabetes, as has been established before. No one can say why type 1 PCOS leads to type 2 diabetes, but it does. However, PCOS does not just lead to type 2 diabetes, it is also leads to gestational diabetes. We all know that diabetes is a lifelong chronic disease and the underlying cause behind 50% of death globally. In fact, in 2016 or 17, it was the largest killer in Indian society. Most cases of PCOS remains undiagnosed, leading to a rise in instance of diabetes in women. Blood pressure. Diabetes and blood pressure go hand in hand. Nobody knows if diabetes causes blood pressure or blood pressure causes diabetes, but the presence of one is a sure shot indication of the other. Liver disease or non-alcoholic fatty liver. PCOS affects the liver, making it weak and exposing infections. This reality was revealed and confirmed in a recent study. Hormonal imbalance in the body directly contributes to the deterioration of liver health. This is also leads to obesity, which leads to the development of the non-alcoholic fatty liver. Depression and anxiety. Female sex hormones also have an effect on a woman's psyche. This means that any disturbance in the delicate balance of hormones leads to mood swing. Furthermore, obesity results in social circulation, and damaged self-image. All this lead to the development of depression or anxiety in women. In fact, a study revealed that women with PCOS are prone to suffer from postpartum depression. Sleep apnea. Obesity causes sleep apnea, which leads to putting stress on the body and mind, which leads to psychological issues as well as the development of more adipose tissue in the body. Heart disease. PCOS does not only leads to the development of diabetes and blood pressure, it creates the deadly cocktail of high cholesterol, blood pressure, and diabetes. This leads to high risk of developing heart disease, leading to strokes or heart attack. Management of PCOD or PCOS. Dietary management. While many lifestyles recommendations are suggested for those women suffering from PCOD, patients are encouraged to follow a PCOD diet with low fat and carbohydrate content. This would prevent any sudden upsurge in patient's body patient's body sugar levels and help them to keep a check on their body weight. Foods that may be included are focus on wholesome foods as these do not contain preservatives, chemicals, hormones, and artificial sugar. Add more fresh fruits, veggies, legumes, and whole grains to their diet while avoiding processed food products. Make sure to have healthy portions of protein in diet. Add anti-inflammatory foods to the diet, including green leafy vegetables, tomatoes, olive tree nuts, fatty fish. Eat iron-rich foods, including broccoli, spinach, dates, and eggs. Magnesium-rich foods like bananas, spinach, almonds, and cashews are PCOS friendly. Supplements are recommended as they are seen to improve the PCOD symptoms. Take selenium supplements, omega-3 fish oil, chromium, vitamin D, vitamin B complex, vitamin D plus calcium, and inositol. Foods to limit. Foods high in refined carbohydrates like white bread and muffins, sugary snacks and drinks, inflammatory foods like processed and red meats. Modern treatment of PCOS or PCOD. In allopathy employs a series of medicines and weight loss programs to manage symptoms of PCOS. To encourage regular menstruation, women may be asked to go on a monthly oral contraceptive pills to help treat infertility or to make a woman pregnant. She may be assigned a medicine to coax ovulation. Some women are also assigned periodic meds, including medicines which are taken around the menstrual cycle. These medications can be taken after every 3-4 months. In addition to this, patients may also be put on diets to help reduce weight. The doctor may also prescribe some high energy exercises to achieve the same. In homeopathy, homeopathy is a legitimate form of alternative medicine. Homeopathy believes in identifying and rectifying the root cause. Homeopathic practitioners provide an extremely low dosage of disease-causing substances in the bodies of the patients. The symptoms ideally get worse before they get better. It should be understood that homeopathy is a long-term treatment and symptoms may take time to subside. Patients should also consult their doctors before mixing homeopathic and allopathic treatments. In Ayurvedic or herbal medicines are more body-friendly, natural, and safe. They also emerge from From a wealth of thousands of years of medical practice, Ayurveda believes that PCOS is caused because of an imbalance of the Rakta and Shukra Dhatu. PCOS also caused an imbalance between doshas. According to Ayurveda, seeds are accumulated impurities in the body. Women suffering from PCOS are put on a strict diet and 1 hour of exercise daily. There are several herbs that could help with treating PCOS, like Shilajit, Vrikshamala, Harida, Amlaki, Neem, Ashwagandha. Next is yogic management. Yoga can help a massive role in the prevention and management of PCOS, since yoga works at levels deeper and more intensive than the physical levels. Yoga can help release stress, which can relieve PCOS symptoms. Asanas or yoga posture designed for polycystic ovary syndrome promote relaxation using pranayama breathing exercises, which help to calm the mind and help open up the pelvic region of the body. Yoga asanas for PCOS can help to manage the symptoms of PCOS, relieve anxiety, and improve emotional and physical symptoms. The practices for the management of PCOS or PCOD are as under, that is kriyas like Kapalbhati, performing Sudarshan Kriya help a woman with PCOS deal with mood swings. Yogasanas like Setu Bandhasana, Bhujangasana, Naukasana, Savasana, Supta Baddha Konasan, Balasan, Dhanurasan, Salbhashan, Chakki Chalanasan, Varadvajasan, Surya Namaskara, Janusarasan, Ardhamaschandriyasan, and Natarajasan. Pranayam like Nadi Sadhana, Brahmari, and meditation, Padma Sadhana, and breathe awareness.
Okay, very good. Any question from anyone? अच्छा एक है जैसे यहाँ पे त्रिशा आई थिंक यू हैव कॉपीड इट फ्रॉम समवेयर दैट्स व्हाई सुदर्शन क्रिया इज देयर if Sudarshan Kriya is there, that is art of living. Okay.
Yes, I googled it here. There was said that some Om chanting kind of.
Yes. So Sudarshan Kriya is I think everyone don't know that things how to practice. So okay, no problem. But overall is good presentation, and this is the concept. Okay, how we need to conclude everything when sets, cause, symptom, so that everyone could at a glance you can identify, okay, what is the problem and what is the precaution need to be taken, and yoga how it could help us. Okay, Anam, go ahead.
I just have to activate some permission.
No, the permission is given. Just
No,
share
from
screen,
my
go to share.
यहाँ पे it's saying security privacy to grant access. So I'll just quickly grant access from my computer.
Okay.
So if someone else would like to continue for the timing, I'll just quickly do this because it may take me a minute or two.
Okay. Arundhati,
Sir?
are you ready?
Yes, sir.
Okay,
So what
go
should I do,
ahead.
sir? Share screen?
Yes, share screen. Go to share screen. First, you need to open that PPT first on your desktop.
Ah, did it open, sir? Okay. Should I do it then? I can start. Okay.
Yes, yes. Go ahead.
Okay, I'm going to present on hypoglycemia, which is basically low blood sugar and how to manage it in the body. First, we'll discuss what is hypoglycemia. As you can see in the picture, hypo means low. So hypoglycemia means an abnormally low, oh, sorry, can't see. Low level of glucose in your blood. And that level, if it reaches below 4 millimoles per liter, then it's considered as a hypoglycemic. And if the body is the glucose level is too low, then the body does not have enough energy to carry out its activities. Some of the symptoms that we can see when the body indicates that the blood sugar level is dropping, we have certain warning signs. And this gives the person enough time to correct it. The symptoms start to occur when the sugar level drops below 4 millimoles per liter. Those with diabetes are advised to check blood glucose level regularly with the help of a glucose meter, as they're the most susceptible. Symptoms can vary from person to person and they become more severe with time if the early signs are not treated promptly. So there's a range of symptoms that start. There are pre-symptoms like blurred vision and trembling. And as the symptoms get stronger, the patient may feel difficulty concentrating. They may have disorderly or irrational behavior. They face confusion, irritability, palpitations, trembling, sweating, fatigue, dizziness. They can go pale, they start feeling hungry, or they feel a tingling feeling on their lips. These symptoms can be observed even while a patient is sleeping, and this is known as nocturnal hypoglycemia. It's the most common in those that are being treated for diabetes with insulin. The patient will experience disturbed sleep, excessive sweating, and disorientation on waking up. The problem here is that the longer someone lives with these conditions, the less obvious the symptoms get. So your body starts basically getting resistance to the low sugar level, and your body is not giving you the symptoms in time. So this puts them at a significant risk of having severe episodes where they become dependent on others for help because they may become unconscious. So this is the cycle of how your body gains that immunity. It diminishes the autonomic response to hypoglycemia. So you have the mind, which is the brain has recognized the recurrent hypoglycemia. So what happens is the increased GLUT1 activity, which is an enzyme, it alters the VMH sensing of glucose, which is what's sending the signal that the glucose level is low, and the level of GABA is increased, and then you feel the symptoms. So it sort of inhibits the sense response, and your body then does not give the signals the same way. The signals which are, as I mentioned earlier, like reduced sweating, it'll show reduced sweating, a part of the glucagon production under autonomic control is reduced. So you're dependent on an external hormone. There's a reduced production of catecholamines and absence of tremors and an absence of palpitations. Now, the causes of hypoglycemia is mainly associated with diabetes. If a patient takes too much insulin, or they miss a meal, or they exercise too much, the sugar level drops. For those who do not have diabetes, hypoglycemia is seen in very rare cases, mostly associated with the malfunction of pancreas where too much insulin is produced. It can also be triggered by malnutrition for people who do not eat, or they do not eat a balanced diet, or they excessively drink alcohol, or they have a certain condition like Addison's disease. This is a disorder of the adrenal glands. So it's also hormone based. Some medicines have side effects leading to hypoglycemia, like someone who's taking quinine for malaria may undergo a drop in their glucose level, which will be a temporary hypoglycemia, or propranolol for high blood pressure. This also does the opposite. The treatment, like for home remedies, most cases can be treated by the patient itself if they are able to recognize the symptoms in time. So they can consume rapidly acting carbohydrates like fruit juice, some dextrose pills, or a bunch of sweets, which instantly shoots up the sugar level and they feel less tired. Then they can proceed with some slightly more substantial food like biscuits, a cereal bar, or a sandwich. In severe cases, like we mentioned earlier, sometimes the patient can become unconscious because their sugar level drops to such a level. In this case, they will need an injection in the form of hormone glucagon. This can only be administered by someone who is trained to give the injection. We can note here that glucagon is basically the broken down version of glucose. So your body basically doesn't have to undergo the process of breaking down carbohydrate to glucose to glucagon. You're directly giving the patient glucagon, and that's how the sugar level comes back up. Now, to prevent low blood glucose, blood sugar level, we can look out for the early signs before it gets severe. If the patient is diabetic, it is important to stick to the medication plan and eat at regular intervals. Blood glucose must be monitored through the day, especially before driving. Driving becomes dangerous because if their blood level drops while they're on the road, they may start getting disoriented, and this can lead to other problems. Avoid strenuous exercise and intake of alcohol on empty stomach. Avoid fatty food and drinks as they don't usually contain as much sugar, and the sugar that they have gets absorbed more slowly. Now, to maintain the blood sugar level with yoga, there are a few practices that we can use. It's difficult to avoid it, but to maintain it and to keep a balance of blood sugar in the body, Surya Namaskara is a very important practice. It keeps the heart rate up and it stretches the entire body, which improves the circulation, it improves the blood sugar levels, and it manages insulin in the body. Dhanurasana, where we're stretching the abdominal muscles, helps in regulating pancreas and balances the blood sugar level. Paschimottanasana reduces the blood pressure and balances insulin levels in the body. Tadasana improves concentration. This creates more space within the body and allows the organs to work more efficiently, thus improves the blood circulation and promotes insulin sensitivity to control blood sugar levels. So here you're retraining your body to be sensitive to the symptoms, which over time can become less sensitive. Ardha Matsyendrasana improves the energy levels and it promotes release of insulin in the body, energizing the body automatically. Chakrasana strengthens the pancreas, stimulating production of insulin and regulating the blood sugar level. Kapalbhati Pranayam improves efficiency of pancreas. Here it is very important to note that yoga is normally done on an empty stomach, but in the case of those with hypoglycemia, a light snack must be taken before any activity. Here we have the steps of the aforementioned yoga poses and breathing exercise. We have Tadasana, Dhanurasana, Paschimottanasana, Ardha Matsyendrasana, Chakrasana, Kapalbhati Pranayam, and Surya Namaskar. I have mentioned the sources, and that is the end of the presentation.
Here you should not use Kapalbhati as a pranayam.
Oh,
You know, na? Pranayam, Kapalbhati is a Satkarma.
oh, right.
Yes. So maybe in over the internet, lot of people they are saying that Kapalbhati is a pranayam. Maybe it's the practice, whatever that is using, that is maybe it's a pranayama category में आते हैं, but as a student of yoga, we are not allowed to say Kapalbhati is a pranayam.
I see. Thank you, sir. I'm going to change this right now. नहीं तो मैं बाद में I'll do this again.
Okay. Arundhati.
Yes, sir. Share
Okay.
screen. No?
Yes, yes.
कहाँ चला गया फिर? शेयर स्क्रीन की अच्छा पीपीटी में जाऊँ
हाँ पीपीटी एक बार ओपन करके रख देना है लैपटॉप में हाँ फिर ये जूम स्क्रीन में आना है जूम पे फिर शेयर स्क्रीन में जाके वो पेज को ढूंढ के उसको सिलेक्ट करना बस हो जाएगा
एक मिनट सर
हाँ
मेरा आ रहा है क्या स्क्रीन
नहीं
नहीं आ रहा है एक मिनट
वो खोल के रखो वो
हाँ,
बंद
वो
नहीं करना है
ना वो खोल के
फिर नीचे जाओ या शेयर स्क्रीन में जाके क्लिक करो
शेयर स्क्रीन दिख नहीं रहा है ना एक मिनट
नीचे नीचे ये देखो चैट है पोल चैट शेयर स्क्रीन रिएक्शन नीचे वाला रो में
हाँ
जहाँ पे म्यूट अनम्यूट करते हो ना
एंटायर स्क्रीन
इसमें एंटायर स्क्रीन नहीं
एक मिनट के सर
अच्छा मैं बोल रहा हूँ देखो
बोलिए।
ऑप्शन क्या क्या आएगा ये देखो म्यूट स्टॉप सिक्योरिटी पार्टिसिपेंट्स पोल चैट और नीचे शेयर स्क्रीन भी आ रहा है आया ना
आ तो रहा था सर अभी लेकिन जब मैं अपना
और शेयर स्क्रीन में क्लिक करो
एक मिनट हाँ अभी शेयर स्क्रीन अभी तो शेयर स्क्रीन की हूँ मैं
हाँ शेयर स्क्रीन करने के बाद देखो बहुत सारा स्क्रीन आएगा उसमें वो जो अगर तुम वो पीपीटी जो है वो भी एक छोटा होके वो दिखाई देगा फिर उसमें क्लिक करने से वो खुल जाएगा वो शेयर हो जाएगा
अरे यहाँ पे
हाँ
अब आया
तो बस आ रहा
बट मेरा कहाँ
है
गया
रुको एक मिनट और एक बार खोलो
और एक बार फिर से शेयर स्क्रीन करूँ
हाँ फिर से शेयर स्क्रीन
हाँ अच्छा
नहीं ये तो जो हम लोग पढ़ाई कर रहे हैं ये वाला स्क्रीन हो गया
न्यू शेयर सर नहीं हो रहा है एक मिनट सर बताइए फिर
हाँ बस अभी हो गया तो हो गया और कुछ कहीं पे नहीं अभी ये कोने में जाके वो देखो
आया
हाँ आ गया वो फर्स्ट वाले में क्लिक करो
हाँ कर दी सर इंट्रोडक्शन
नहीं इंट्रोडक्शन के पहले भी और एक पेज है तुम्हारा
टॉप
पेज में
प्रीनेटल योगा पोजेस
हाँ फिर ये जाके यहाँ पे नीचे जाके क्लिक करो रुको
माइंड क्लास में एक मिनट सर सेकंड पेज में आ जाओ
अरे यहाँ से
इंट्रोडक्शन
नहीं फुल स्क्रीन करना है ये देखो नीचे में जाके ये देखो और नीचे और थोड़ा नीचे कर सकते हो राइट साइड और थोड़ा ऊपर ये नोट्स के बाद जो देखो एक हाफ काफ वाला जो पिक्चर है और थोड़ा ऊपर उसके ऊपर का लाइन और एक के बाद
और के बाद अच्छा
हाँ
वाइन
ये
ग्लास
हाँ ये
स्लो
भाई हाँ
स्लाइड
स्लाइड
शो
स्लो हाँ स्लाइड शो में क्लिक है
ओके, एक मिनट रुको सर, नेक्स्ट क्या करूं सर?
अभी ये नेक्स्ट करो, नेक्स्ट
हाँ
जो
हाँ
बटन
हाँ
है
next,
तुम्हारा
हाँ सर,
उसमें
अभी
क्लिक करो।
आया सर, अभी
हाँ
आया,
हाँ हाँ, एकदम
विजिबल है ना सर?
एकदम
ओके, मैं रीड करूं?
एकदम।
Pregnancy, sir, my topic is uh, prenatal yoga. Okay, prenatal care yoga. So, pregnancy is a beautiful time in every woman's life. As a new life starts out in your womb, your body goes through a number of small and big changes. Everyone talks about taking care of your unborn baby and showering him or her with love and affection. Why they don't pay enough stress is on that is you need to give yourself love and attention to. Yoga and pregnancy. Practicing yoga poses during pregnancy balances physical and mental well-being and is a great way to stay active. Yoga not only helps in physical fitness, it has meditative and spiritual values. It keeps the body fit and flexible, reduces anxiety and helps to keep calm. During pregnancy, the body needs more oxygen. The breathing techniques helps the expectant mother to increase the lungs capacity. It also improves the sleep and help the mother to get ready for the childbirth. Yoga also boosts confidence levels and helps expectant mothers get over the fear of how they will handle the next days of their lives. Pregnancy yoga helps the mother bring the unborn into the world with minimum hassle and completely no health complications. Positions and exercises practiced across the 3 trimesters of pregnancy can differ with every phase. Yoga can be practiced by anyone, but not all types of yoga are beneficial for the expectant woman. They should avoid trying new postures and go slowly in progress. It is important to tell the yoga teacher about the pregnancy. As the pregnancy progresses, the center of gravity will shift. This will increase the risk of losing balance, and hence it becomes important to use the support of a wall or chair whenever needed. Poses that encourages opening of hips and pelvis can facilitate comfort throughout pregnancy and easier labor. Iyengar yoga method is unique in using variety of props so that the mother and the baby can get maximum benefit without any strain. The Iyengar yoga approach creates space within the uterus, ensuring proper blood circulation and adequate room for the baby to move. Prenatal yoga sessions can be divided into 3 trimesters. Yoga for the first trimester, for the second trimester, and for the third trimester. For the first trimester poses, you can continue your regular physical activity when you enter the first trimester, but keep in mind to modify the poses appropriately. Go for the poses that focus on the lower back and hips. Your aim should be to build a strength and ease the tension of your body. The first one is the butterfly pose. The picture is there. This pose stretches the muscles of the groin while opening up the hips. The back will get a nice stretch as you fold forward. Second is the cobra pose. The cobra pose helps to stretch the lower back while relieving the back pain. Then the puppy pose. The puppy pose is great for the moms who are feeling nauseous. It is preparatory pose that you can do before the downward dog. It lengthens the spine and opens up the shoulder. Cat and cow pose का ऐसा picture अभी नहीं डाली. The cat and cow pose helps to relieve pressure on the lower back while stretching the spine. The muscles around the pelvis are also loosened. Then the child pose. This is a resting pose that stretches the back muscles while lengthening the spine. It also helps to reduce stress and anxiety. Then comes the second trimester. During the second trimester, your body begins to produce a hormone called relaxin at a high levels. This prepares your body for birth while relaxing your muscles, ligaments, and tendons. While this change might make you more flexible, be very careful not to overstretch. Do not push your body limits. There are 5 yoga poses for this. First is the mountain pose. This basic pose is perfect for the moms to be as it helps in the spinal and pelvic alignment. It also strengthens the glutes, thighs, knees, and the ankles. The second is the warrior two. This pose helps to open up the inner thigh, strengthens the muscles of the legs, which is great for the active labor. Then extended side angle pose. This pose stretches upper back muscles to the abdominal region, and it also opens up the chest while letting you breathe deeper. Then the balancing table pose. This pose helps to focus better while improving balance and coordination. It also strengthens the core muscles while aids in supporting the baby's growing weight. सर उसके बाद मेरा स्टॉप शेयरिंग कर दो. दिस इज नॉट कंप्लीट सर. सर स्टॉप शेयरिंग करो.
Go first.
हाँ सर. सर मैंने इसमें बहुत चीज अभी तक किया नहीं है जिसमें द थिंग्स टू अवॉइड लाइक द थिंग्स ऑफ फिजिकल एक्टिविटीज टू अवॉइड, जैसे कि इन्वर्सन नहीं करना है फर्स्ट ट्राइमेस्टर में. सेकंड सर मेरा स्क्रीन कुछ नहीं आ रहा, ब्लैंक हो गया.
नहीं, अभी तुम इसमें आ जाओ. जूम पे देखो, देख पाओ.
एक मिनट सर. जूम पे एक मिनट. हाँ सर. सर मैं दिस इज नॉट कंप्लीट येट, तो इसमें मेरे को बहुत चीज इंक्लूड करना है.
एकदम कंप्लीट करो, देन विल सी अगेन. क्योंकि ये मतलब व्हाट इज प्रेगनेंसी एंड वहां से जैसे थोड़ा बहुत स्टार्ट हुआ है, बट ये और भी परफेक्ट करना होगा. ओके,
लेकिन इंट्रोडक्शन में सर व्हाट इज प्रेगनेंसी से स्टार्ट करना है.
यस.
ओके सर, उसमें और डाइट भी लिखना है.
सब कुछ लिखना है. डाइट तो लास्ट में आएगा. द योगिक मैनेजमेंट ऑफ, जैसे मॉडर्न मैनेजमेंट ऑफ लाइफस्टाइल फॉर दिस प्रेगनेंसी, और वो योगिक वे ऑफ मैनेजमेंट और योगिक वे ऑफ हैविंग फूडिंग, सब कुछ.
प्रोसीड्यूर स्टेप्स नहीं लिखना है ना.
नहीं.
स्टेप्स फॉर द एंड जैसे 3 ट्राइमेस्टर्स में जितने योगा पोजेस है उसका पिक्चर्स तो देने हैं और स्टेप्स नहीं लिखना है, और डाइट्स मेंशन करना है एंड योगिक मैनेजमेंट. जब बाकी सब थोड़ा जितना शेयर किया उतना थोड़ा ठीक है ना, नहीं है.
हाँ ठीक है, मतलब स्टार्टिंग तो ठीक है.
ओके सर.
हाँ. रितु.
Unmuting, yeah, I'm sorry. So is it visible?
Oh, yes, visible.
All
Just
right.
start that what's called slideshow.
Slideshow. Is it working, sir? Because I've already started.
No, slideshow start नहीं हुआ.
नहीं हुआ.
68% जहाँ पे लिखा है उसके बगल में वो स्लाइड शो का बटन है, देखो. हाँ, क्लिक करो.
किया सर. अभी हो रहा है, अभी शो हो रहा है सर. Please move this window away from the shared application.
कोई दूसरा कुछ एप्लीकेशन खुल गया है तुम्हारे सामने? और एक बार क्लिक करो.
स्टॉप करके.
नहीं. ठीक है, कंटिन्यू करो. आई थिंक इसमें कुछ टेक्निकल.
अभी भी नहीं शो हो रहा सर.
नहीं, फुल स्क्रीन नहीं हो रहा है.
हाँ.
नहीं तो वे स्लाइड शो वाला ऊपर में जो ऑप्शन है ना,
सर
इंसर्ट डिजाइन.
F5 होता है सर ऑप्शन, मतलब शॉर्टकट उसका हो रहा है. अभी शो हो रहा है. सर अभी शो हो रहा है.
हाँ, perfect.
So, sir, my topic for today is management of thyroid disease. First and foremost, what is thyroid? The thyroid gland is a small organ that's located in the front of the neck, wrapped around the windpipe, called fascia. It's shaped like a butterfly, small in the middle and two wide wings that extended out around the side of your throat. Your thyroid makes hormones that helps control many vital functions of your body. This is the picture of the thyroid gland in our neck. So this actually seems like a butterfly. And when the thyroid doesn't work properly, it impacts our entire body. And if this gland makes too much of thyroid hormone, the condition that it develops called hyperthyroidism. And when it makes too little thyroid hormones, we call it hypothyroidism. I don't know if I'm pronouncing it right. Hypothyroidism. Okay. So what is the disease all about? When the thyroid, as I mentioned, that when the thyroid makes too much of thyroid hormones, we call it hyperthyroidism. The body uses the energy very quickly, and a person make heartbeat faster and cause a
नहीं, in the second में नहीं जा रहा है. You are saying second slide दिख रहा है? No.
now.
No. ऐसे normally करो, ये अच्छा रहेगा.
All right, sir. So basically, it can also it can make the heartbeat faster and cause a weight loss without even trying it, and make the person feel nervous most of the time. So on the flip side of this, when the gland makes too little of hormones, it is called hypothyroidism. And when it produces little hormone to the body, it make you feel tired at the same time, like in the hyperthyroidism condition. And but in this case, person gain weight quickly, and the person even be unable to tolerate cold temperatures. So these are the conditions. Now we'll talk about the causes. For hypothyroidism, the condition called thyroiditis, which is the swelling in the neck area in the thyroid gland itself. So when there is a swelling in the thyroid gland, the hypothyroidism is the condition. And there's other painless disease, that is Hashimoto's thyroiditis. It is an autoimmune condition where the body cell attack and damage the thyroid gland. Postpartum thyroiditis, and this is the condition occurs in 5 to 9% of the women after childbirth. So this is again very serious problem. And due to the deficiency of iodine in the body, the hormone, the thyroid do not produce sufficient hormones. A non-functioning thyroid gland is another cause. Sometimes the thyroid gland doesn't work correctly from the birth itself. So, and for hyperthyroidism, grave disease. This is the condition. The entire thyroid gland might be overactive and produce too much hormones. Nodules is the other cause. Hypothyroidism can be caused by nodules that are overreacting within the thyroid. Thyroiditis, as in the hypothyroidism condition, this disorder can be either painful or not felt at all. In thyroiditis, the thyroid releases hormone that was stored there, that was already stored there. And excessive iodine. When we have too much iodine in our food, in our body, the thyroid makes more thyroid hormones than it is required. So, and the major cause, which is not mentioned over here, is the stress. Stress is the major cause of the thyroid disease in us. Okay. The symptoms that the person with thyroid disease will have, they experience anxiety, irritability, and nervousness, having trouble in sleeping, They lose weight quickly without even trying to do that, and having an enlarged thyroid gland or a goiter that we call, and having muscle weakness and tremors, experiencing irregular menstrual periods, or having your menstrual cycle even for some it even stops, feeling sensitive to heat, and having vision problems or eye irritation. Hypothyroidism, um, in this people person feel tired, fatigue, they gain weight, experience forgetfulness, having frequent and heavy menstrual periods, having dry and coarse hair, having a hoarse voice, and experiencing an intolerance to cold temperaments. So these are the symptoms for both of the conditions. And what are how we diagnose this disease and what are the treatments? There are three diagnoses: blood tests, imaging tests, and physical exams. Physical exam is basically the patient needs to go to the physician or doctor to for the checkup, and they actually check it and tell if the person has a disease or not. And imaging test, it can be ultrasound or scanning of the neck area, and blood test also is the other tool for diagnosis. And the treatment of diagnosed diseases for hypothyroidism, there is an anti-thyroid drugs. There are two common drugs, methimazole and propyl thyroxine. Okay, so these are the medication that can stop thyroid of making excessive of hormones. Radioactive iodine, this treatment damages the cell of the thyroid, preventing it from making high level of thyroid hormones. Beta blocker, these medications don't change the amount of hormones in the body, but they help manage the symptoms. And the other is surgery. It removes the thyroid overall, and this will stop creating the hormones. For hypothyroidism, there is a thyroid replacement medication, and this drug is synthetic and man-made way to add thyroid hormones back into the body. So these are the treatment for it. Uh, Yogic treatment, we have some asanas. Sarvanga asana. This is the posture where the more stress is on neck and shoulder area, and it stimulates the thyroid and parathyroid glands and normalizes their functions. It also strengthens the arm and shoulder and keep the spine flexible, basically. And the same is with Viparit Karni. Uh, uh, However, it is good for the overall arm strength and give sufficient stress to the neck area and the shoulder area. Surya Namaskara is also very helpful in managing the thyroid disease. Janu Shirshasana is very good for the back pain and strengthening of the uh, arm and shoulders. The other asanas are Matsasyasana, um, Marjari Asana, Halasana, Setu Bandhasana, and Shishu Asana. All these are very helpful in managing the thyroid disease. When it comes to pranayam, Ujjayi Bhramari pranayam, Nadi Shodhan pranayam, and cooling pranayam such as Shitali and Shitkaris are considered to be very effective in dealing with hyperthyroidism symptoms. Also, it's good to practice a few minutes of meditation every day in both of the conditions. Hyperthyroidism patients who became laid back due to the condition will need to make a conscious effort to stay physically active. So, and here is when meditation can help them strengthening their willpower to do so. So these are the pranayam in thyroid management, and food tips for the people who are suffering for thyroid disorder. is that they must include high fiber food in their diets, reduce the intake of fats and carbohydrates, takes a lot of fresh fruits and green leafy vegetables. It is better to avoid cauliflower, cabbage, and broccoli in hypothyroidism. Limit the intake of non-vegetarian food, milk and milk products. Skimmed milk is advisable. Rice, spicy food, refined and fast food, and food items with preservatives. So this will basically help the person to manage the thyroidism. Thank you so much.
ओके, थैंक यू, बहुत अच्छा। सभी अपने अपने हिसाब से अच्छा ही बनाए हैं। आई एम क्वाइट हैप्पी। तो ऐसे ही
But sir, mine is incomplete.
इनकम्प्लीट है, वो कंप्लीट हो जाएगा।
अभी से
That
सबका
does not
देख
matter.
के मुझे लगा कि अभी कि इसमें और बहुत
एकदम
सारा
एकदम इसलिए आज हम क्यों बोले कि नहीं इसको कंप्लीट करना है, सो दैट किसी का कंप्लीट है, शायद हो सकता है कोई एक आइडिया मिल गया हो किसी से,
Yes,
कोई
actually.
दूसरे का, तो वो कहाँ पे मेरा कमी है और उनका स्लाइड उसमें बहुत अच्छा है, सो आई कुड एबल टू इनकॉर्पोरेट दैट थिंग्स टू माय
Exactly.
स्लाइड। ठीक है, तो एक बार सभी ऐसे ही आगे बढ़ते रहे, सो दैट इसका नॉलेज भी डेवलप हो जाएगा। कहीं पे प्रिपेयर प्रेजेंटेशन भी होगा तो भी वो हम लोग इजीली कर पाएंगे। एंड हर एक डिजीज के ऊपर एक थोड़ा बहुत आइडिया, जैसे कोई थायराइड के ऊपर कर रहा है, कोई लो ब्लड प्रेशर, कोई, तो हर एक चीज को थोड़ा बहुत जानकारी सभी के सामने आ जाएगा।
Sir,
हम्म
सर प्रीनेटल कंडीशन इज नॉट अ डिजीज, सो इसमें इसलिए मैं कंफ्यूज होके मुझे समझ नहीं आया कि मेरे
नहीं
को
वो
क्या क्या।
डिजीज नहीं है वो,
हाँ तो ये
मतलब प्रीनेटल में क्या क्या हार्ड, मतलब हार्ड सी बातें हैं, ठीक है,
ओके।
दैट
I'll
इज नॉट
start from
डिजीज।
pregnancy. What is pregnancy?
हाँ,
And then the
व्हाट
phases.
इज स्टेजेस, उसमें बेबी का फेटस, वो फेटस से क्या उनका क्या क्या डेवलप होते हैं, क्या क्या ग्रोथ होते हैं, और उनको जब भी मदर एज ए मदर व्हाट सी नीड टू बी डन, ठीक है, वो सब कुछ उसमें योगी कॉन्सेप्ट ऑफ व्यू से, तो ये बहुत वास्ट मैटर है, इतना इजीली नहीं है। अच्छा ठीक है, ये फर्स्ट सेमेस्टर में ये आसन कर लेंगे,
No,
आसन
no.
क्यों करेंगे, प्राणायाम क्यों करेंगे, उसका रीजन भी वहां पे उल्लेख करना है और उसको जाके कंक्लूड करना है। ठीक है, सभी को मैं बोल रहा हूँ, जैसे कोई एक डिजीज, उनका कॉज क्या है, इफेक्ट क्या है, और जैसे कोई एक आसन करेंगे, कोई एक प्राणायाम करेंगे, क्यों वो प्राणायाम, वो आसन उसमें बेनिफिटेड है, वो भी खुद को एक इसमें अगर थोड़ा बहुत लिख पाएंगे ना, तो बहुत अच्छा रहेगा कि अच्छा ये दिस practices activates this gland, this practices activate that gland, so that's why this is very effective। तो ये अगर हम लोग कर पाएंगे, इट विल बी गुड। ठीक है, ओके। लास्ट डे हम लोग कौन सा टॉपिक तक पढ़ाई किए थे?
ज्ञान योगा, भक्ति
ज्ञान
योगा, भक्ति योगा फिनिश हो गया था।
भक्ति योगा हो गया। ओके, देन वी आर गोइंग टू डिस्कस अबाउट कर्म योगा।
कर्मा योगा भी शुरू किया था, so we started the discussion. We did the karma yoga laws also.
तब तो हो ही गया शायद। Yes, laws of karma means completed.
Completed, yeah.
Then concept and principles of Sukshma Vyayama, Sthula Vyayama, Surya Namaskara and their significance in Yoga Sadhana, इसके बारे में चर्चा करेंगे। अच्छा, सूक्ष्म व्यायाम जो लेवल 1 पे हम लोग जानते ही हैं वही सूक्ष्म व्यायाम इसमें भी है। सूक्ष्म व्यायाम क्यों करते हैं, दैट इज वेरी इंपॉर्टेंट। जिसका सूक्ष्म शरीर है वही सूक्ष्म व्यायाम का अभ्यास करेंगे। कोई सूक्ष्म व्यायाम अगर अभ्यास करते हैं तो वो समस्त शरीर का वो वर्कआउट हो जाते हैं। सूक्ष्म व्यायाम इज द सिस्टम ऑफ द फिजिकल एंड ब्रीदिंग एक्सरसाइज which helps to syncretically work out all joints of a body to warm it up. This system has a strong purifying effect on the energy of the body. इनके अंदर में strong purifying effects है, which is very important. जैसे ये सूक्ष्म व्यायाम का अल्टीमेट क्या समझा जाता है कि इट्स हर शरीर का हर एक जॉइंट को वो मोबिलाइज करता है। एंड इफ इट इज मोबिलाइजिंग तो वो बहुत अच्छा स्थिति में रहते हैं। हम लोग जानते हैं कि सूक्ष्म व्यायाम इटसेल्फ इज ए कंप्लीट ट्रीटमेंट। जैसे कोई बुजुर्ग व्यक्ति आते हैं, कोई डिजीज पर्सन अगर आते हैं, तो हो सकता है कि उनको उनको कोई आसन, कोई प्राणायाम, कोई मुद्रा, कोई बंधा उनको अभ्यास नहीं करवाए। सिर्फ सूक्ष्म व्यायाम के द्वारा भी वो स्वस्थ रह सकते हैं। In the world, the oldest element in yoga, which is unknown to many yoga schools today, is Sukshma Vyayama, which was propagated, designed, and developed initially by Maharishi Kartikeya Ji Maharaj of Himalaya. He had great compassion and empathy for humanity and taught Swami Dhirendra Brahmachari, 1924-1994, who is in turn propagated it across the modern world. However, literature of Hatha Yoga is full of references to the philosophical importance which is attached to the mudras and bandhas. Both in India and abroad, many of the yoga schools in the modern era have ignored comfortably this aspect, maybe because of their own unfamiliarity with or ignorance of this particular subject. Mudras and bandhas, in fact, are very complex. This can only be practiced by the modern yogis in the original form, which is prescribed in the text of yoga, such as Shiva Samhita and Hatha Pradipika. Once I have practiced a yoga session by a renowned yoga guru. He is from, I think, Portugal. Okay. So that Guruji, when he started his class, he have started with splitting. Split से start किया, मतलब विभक्त आसन से, standing, मतलब वो हनुमान आसन बोल सकते हैं। तो हनुमान आसन से उन्होंने पहले क्लास स्टार्ट किया। नो नथिंग, नो मतलब कुछ भी सूक्ष्म व्यायाम वो करवाया ही नहीं, लेकिन सेशन अच्छा था। लेकिन देखो, आज कोई व्यक्ति अगर वो हनुमान आसन करने की स्थिति में है तो करवा सकते हैं, लेकिन अगर नहीं है तो व्हाट टू डू। लेकिन वो तो करवा दिए। उनका जो भी डिसाइपल्स थे वो ही केम इंडिया विथ हिज 400 डिसाइपल इन दिल्ली। देयर वाज प्रोग्राम, तो 400 लोग वो लेके आए एक साथ। And from there, from Delhi, they went to, I think, Rishikesh. उन लोगों का ऋषिकेश का प्रोग्राम था। मतलब basically they came for that retreat type का thing. तो उन्होंने वैसे कुछ प्रैक्टिस करवाया ही नहीं। क्यों नहीं करवाए? Maybe they don't know. ऐसा नहीं कि वो प्रैक्टिस नहीं करेंगे।
इग्नोरेंस होगा सर।
Ignorance, हाँ वही तो, मतलब maybe they don't know. They do not have any idea
They
about
don't believe in Sukshma Vyayama.
हाँ
They don't believe in Sukshma Vyayama. माने उनके लिए Sukshma Vyayama is nothing. Why to do
नहीं नहीं नहीं,
stretching?
ऐसा नहीं, इसका बेनिफिट के बारे में मालूम नहीं है,
हाँ वही मतलब हाँ.
तो इसलिए ऐसा नहीं बोला जा सकता है कि अच्छा इट शुड नॉट बी प्रैक्टिस, इसलिए है कि दे डोंट नो, इसलिए दे आर नॉट प्रैक्टिसिंग। बट मुद्रा बंधा ये थोड़ा टफ होता है प्रैक्टिस। बहुत लोग ये सोचते हैं अच्छा ये हाथ को ऐसे प्रेस करने से क्या होगा, लेकिन जो जानते हैं वही जानते हैं कि इसको प्रेस करने से क्या होगा, क्या होता है, और नहीं करने से क्या होता है। लेकिन इसके लिए योग है एज ए प्रैक्टिकल साइंस, मीन्स यू नीड टू प्रैक्टिस, आफ्टर दैट you could able to reveal what is exactly it is, तब जाके पता लगेगा, नहीं तो उसके पहले इम्पॉसिबल। Then in the world the most important beautiful fact of yogic Sukshma Vyayama is that it is the only system of exercises in which every body parts, every muscle, joint, and organ is taken into consideration. Here, a specific exercise or even set of exercises which is linked with a particular kind of breathing in a particular kind of position, having particular mental concentration is recommended. Therefore, we start with the head, which is at the top, then the neck, the shoulder, elbow, wrist, arm, fingers, the trunk, the hip joints, the knees, ankle, feet, and toes. Okay. So all this joint we could able to loosen with the practice of yoga, a Sukshma Vyayama. जैसे ऊपर से नीचे की तरफ बोला गया है, नीचे से ऊपर का भी अभ्यास किया जा सकता है। मीन्स फर्स्ट इज टो, देन ankle, then knees, then क्या बोलते ट्रंक, इस रूप से भी अभ्यास किया जा सकता है। Hence, the sequence mentioned above, which is actually covered from head to toe, is something which is very exceptional in whole world, past, present, and future perhaps. Thus, by its name, Yogic Sukshma Vyayama is only applied to the subtle body, Sukshma Sarira, by working through the gross body, Sthula Sarira. Other separate exercises which are beneficial for gross body are Sthula Vyayama. Sukshma Vyayama is the same as other gross exercises like running and swimming. Several cultural and physical exercise, however, yogic Sukshma Vyayama has a different concept according to Indian traditional philosophy. It is only meant for those human beings who have a subtle body. तो योगिक सूक्ष्म व्यायाम सिर्फ मनुष्य के लिए है, क्योंकि वो दूसरा कोई भी प्राणी इस माइंड लेके उतना नहीं सोचते हैं, ठीक है, क्या उनके लिए वो मैटर नहीं करते हैं। दैट्स वाई एक मनुष्य वो कहीं पे भी आप उसको सोने के लिए दोगे वो नहीं सो पाएंगे, ठीक है। तो बहुत कुछ हम लोगों का क्राइटेरिया रहता है, बिकॉज वी आर ह्यूमन, बट बाकी लोगों के लिए वो नहीं होता है। बाकी कोई भी प्राणी के लिए वो नहीं होता है। The benefit of Sukshma Yoga are immense, direct and immediate. The following are not over the point about Sukshma Yoga. Preferably, it must be carried out twice a day, that is both morning and evening, or can be done once a day in the morning. Can be done after bath if one takes a cold water bath, or before bath if one would take a warm water bath. और क्या है? Can be done before intake of any type of food, can be done on a comfortable surface, can be done either indoor or in open air, can develop extraordinary level of possibilities and capabilities both at physical and mental levels for different trails of personality, which is very important. The कोई भी व्यक्ति ये भी अगर आते हैं तो हर एक के लिए सूक्ष्म व्यायाम उनको बेनिफिट करेगा। अगर कोई एकदम सिर्फ सूक्ष्म व्यायाम अभ्यास करते हो उसको और कोई भी दूसरा अभ्यास करने का जरूरत होगा ही नहीं। For those who have maladies and problems of different kind, Sukshma Vyayama alone is capable of curing and preventing maladies without taking the help of kriyas, asanas or pranayama. It enhances and improves the energy, vigor level in different systems and organs of human body, making it strong. Therefore, Sukshma Vyayama, nonetheless a minor exercise, covers from toes to head. Whole series of joint movement is mentioned below. Whole series of joint movement वो नीचे लिखा हुआ है। That is जो हम लोग अभ्यास करते हैं, नेक मूवमेंट, ग्रीवाशक्ति विकासका, शोल्डर मूवमेंट, भुजवाली शक्ति विकासका, पूर्ण भुज शक्ति विकासका, कटी शक्ति विकासका, देन पद मूल शक्ति विकासका, गुल्फ पद पृष्ठ पद शक्ति विकासका। एंड स्थूल व्यायाम के अंदर में दो है सिलेबस के अंदर में, एक है सर्वांग पुष्टि और एक है रीद गति। हर एक सूक्ष्म व्यायाम by the name we need to identify. Yes, Anna.
So I have a question. Everything apart from these, जैसे जो आपने हमें सूक्ष्म व्यायाम का बुक दिया था और द पीडीएफ फ्रॉम लेवल 1, उसमें दोनों सूक्ष्म व्यायाम भी है, स्थूल व्यायाम भी है, एंड देयर आर मोर देन दिस।
हाँ,
जो ये हमारा सिलेबस में है उससे भी ज्यादा एक्सरसाइज है। So how
वो
can we differentiate सूक्ष्म व्यायाम from स्थूल व्यायाम?
नहीं, स्थूल व्यायाम तो स्पेसिफिक है, सर्वांग पुष्टि, रीद गति वही है।
Only two for
Only
in
two.
world.
Entire that book we have a lot of Sukshma Vyayam also. For neck, maybe we have in our syllabus only 4. Maybe they have 10 Sukshma Vyayama for their neck, but we need to follow only this 4.
Okay.
Other जो भी सूक्ष्म व्यायाम है उसको जरूरत ही नहीं।
But sir, मैं knowledge के लिए पूछ रही हूँ, like what, like अभी ऊपर it was written things like running and swimming, those are also considered सूक्ष्म व्यायाम. But like this piston, ridgati, that is स्थूल व्यायाम, which is technically just a variation of running. It's like running on the spot.
Running on the spot बोल सकते हैं, लेकिन सूक्ष्म व्यायाम when we are doing excessively, we are throwing our hands, it gives a raise heartbeat to our heart. Okay, and second heart is our calf muscle, so it's hitting, so both side वो hit कर रहे हैं. When we are running, we are not hitting our calf muscle to our thighs. कप मसल को याद रखते हुए नहीं करते, और जस्ट दौड़ना है दौड़ते जाते हैं। कप मसल को कोई वैसे नहीं दौड़ते हैं। किसी का एक्सपीरियंस है दौड़ने का? कप मसल थाई पे लगते हैं?
Not, it doesn't, it's not common. Only जैसे जब फुटबॉल वाले लोग they do these, they do for warm up, they do know with high knees and butt kicks and stuff like that, तो वो अलग होता है, that's not really running, it's extra.
एकदम एकदम
ठीक है ठीक है.
Okay. Now we'll move to Surya Namaskar. Okay. We know what is Surya Namaskar. Surya Namaskar is a combination of asana and Sukshma Yoga, Sukshma Vyayama. There are different steps of Surya Namaskar in yoga tradition. Surya Namaskar and yoga asanas are a blessing bestowed to mankind by the ancient sages who devised practice methods to train the body and mind for higher spiritual and material pursuit. According to the sages, body and mind are interrelated. An unhealthy body will house an untempted mind. Hence, it makes sense to keep the physics healthy so that the mind is free, fit enough to succeed in all its good undertaking. Yoga asana make that possible in a very scientific manner. Although it is important to learn the asana, the practitioner must know that right technique and contraindications of asana practices as well. This chapter discusses the advantages of doing Surya Namaskar and then goes on to describe different asana and movement of the spine. कोई व्यक्ति सूर्य नमस्कार अभ्यास कर रहे मतलब हर एक आसन का लिमिटेशन एंड बेनिफिट जानना बहुत जरूरी है. ऐसा नहीं है कि कोई मतलब ओवरऑल बोल देते हैं कि ये सूर्य नमस्कार करने से किसी का जैसे एनर्जी लेवल बढ़ते हैं तो कोई एक व्यक्ति का एनर्जी लेवल कम है बोल के वो सूर्य नमस्कार नहीं कर सकते. दे आर नॉट अलाउड बिकॉज उसमें बहुत सारा पैरामीटर देखना होगा. Whether he or she could able to comply this all those parameters or not, वो एक बार देख के फिर उसके बाद डिसीजन हम लोग ले सकते हैं. अदरवाइज नहीं. हो सकता है किसी का बैक पेन है लेकिन वो उनका एनर्जी लेवल कम है लेकिन उनको बैक पेन है बोल के उनको हम लोग नहीं करवा सकते. ये ध्यान रखना है. ठीक है. इसीलिए बोला गया है कि इंडिविजुअल जो भी प्रैक्टिसेस है उसका बेनिफिट लिमिटेशन यहाँ पे इंक्लूडेड होता है. इसका कोई अलग सा कोई लिमिटेशन और बेनिफिट नहीं है. सूर्य नमस्कार बिकॉज सूर्य नमस्कार इज ए सीरीज ऑफ प्रैक्टिस. Okay, am I right? Then benefit helps in loosening weight, improve digestion, improve posture, relieves and strengthening muscles, improves skin glow, gives you morning energy, helps in detox, improves sleep schedule, ensure hormonal balances and regular menstrual cycle, helps in maintaining a positive vibe. Precaution. People with bone weakness or muscle weakness should avoid it. The sequence should be avoided by people who are suffering from high blood pressure. Those suffering from arthritis should avoid Surya Namaskar. Those with injuries to the wrist should not practice it. Pregnant women should avoid it. So all these things we need to keep in mind while we are making someone practice Surya Namaskar. Any question about Surya Namaskar?
Sir,
Yes.
one day I was practicing Surya Namaskar in evening session. So someone, I forgot her name, she said that I have abdominal bloating. I'm unable to do that. What to do?
You have to, in a group session, you have to say that, okay, wait for next practice. this practice, if you are unable to practice, then just do not need to practice anything. Just see how the things is going. Bas, हो गया. कभी भी किसी को भी ऐसे प्रॉब्लम अगर होते हैं तो वी नीड टू से देम जस्ट वेट, डू नॉट नीड टू प्रैक्टिस. ठीक है. ठीक है. अच्छा, और इवनिंग सेशन लेते हुए किसी का कुछ अपडेट कोई देना चाहते हैं? जैसे तीसा ने जो बोली कि
স্যার
हाँ
স্যার কালকে জিজ্ঞেস করছিল যে মানে একটা হয় মর্নিং এ সেশন, দেন আফটারনুনে একটা ইভিনিং এ হয়. সো একজন জিজ্ঞেস করলো যে আচ্ছা 3টে সেশন করলে কি কিছু প্রবলেম হবে, এরকম আমাকে জিজ্ঞেস.
नो प्रॉब्लम.
আচ্ছা
चलते हुए जा रहे हैं, कोई भी सेशन में आप ज्वाइन करो, प्रैक्टिस करो, बस हो जाएगा.
सर मेरे सेशन में शायद साउंड का बहुत इशू था सर, किसी को
अच्छा अच्छा.
नहीं दे रहा था, बट मैंने फिर भी कंप्लीट किया.
हाँ
मुझे यही लग रहा था कि कैमरा एंड साउंड का मुझे देखना पड़ेगा अलग से.
हाँ, क्योंकि ये भी एक लेसन है हम लोगों के लिए. जैसे जब भी मैं भी फर्स्ट स्टार्ट किया था ऑनलाइन में, फर्स्ट में मुझे भी ये बहुत दिक्कत आया था. जैसे कोई स्टूडेंट बोलते थे कि अच्छा सर आपका आवाज तो बहुत दूर से आते हैं. ठीक है. देन वी ट्राइड फिर न्यू डिवाइस, देन देखा कि अच्छा वो ठीक हो रहा है कि नहीं, फिर देखा हाँ हाँ ठीक हो गया. फिर तो ऐसे ही खुद को ये टेक्नोलॉजिकली, जैसे व्हेन यू आर वेयरिंग दिस हेडफोन, तो तब तो वो बहुत बढ़िया, देयर इज नो प्रॉब्लम. बट व्हेन यू आर फार अवे फ्रॉम योर डिवाइस, तब जाके तो प्रॉब्लम होगा ही.
एंड प्रैक्टिस करते टाइम तो नहीं पहन सकते इसे, या तो ब्लूटूथ वाला वो अलग से माइक होता है जिसको आप यूज करते हैं शायद मॉर्निंग, है ना, वो अलग से लाना पड़ेगा.
हाँ, ये ऐसे नॉर्मली ये कुछ अलग कुछ माइक नहीं है, जस्ट नॉर्मल जो ब्लूटूथ होते हैं, ब्लूटूथ हेडफोन, बस उससे भी चल जाएगा. And this is all the things also part of lesson. We need to prepare ourselves such way so everything got smooth. And देखना जो जो लोग, अभी तो हम लोग भी उतना मॉडर्न इक्विप नहीं है, बट जो लोग ऐसे मॉडर्न ब्लूटूथ है उनका सेशन, मतलब दे आर गेटिंग मोर, क्या बोलते हैं, स्टूडेंट्स और टेक्नोलॉजिकली जो लोग साउंड है. क्योंकि अगर कोई हम लोगों को देख नहीं पाएंगे क्लियरली तो देयर इज अ प्रॉब्लम.
एग्जैक्टली.
वी नीड टू खुद को अपग्रेड भी करना होगा. वी नीड टू अपग्रेड आवरसेल्फ. ठीक है. ये अरुंधति लीव कर गई बिकॉज ऑफ आई थिंक शी इज अनवेल, बोलो मैसेज की. तो नो प्रॉब्लम, आज और हम लोग और आगे नहीं बढ़ते हैं. टुमारो विल ज्वाइन बैक एट अगेन 3 o'clock and will continue. And meanwhile ये जो भी टास्क दिया गया था, आप लोग इसको और भी क्या बोलते हैं, फुलफिल करो, सो दैट ये और भी अच्छा बन जाएगा. एंड सेंड इट टू मी ऑल जब भी ये और भी, अगर इफ यू आर थिंकिंग ओके आई एम ओके, क्योंकि मुझे भी अच्छा लगा ओवरऑल. अगर कुछ एडिट करना है, कुछ ऐड करना है तो ऐड या सब्सट्रैक्ट जो भी करना है वो एक बार कर लो, देन सेंड इट टू मी, देन आई विल सर्कुलेट टू यू ऑल. ओके, so that will be better. तो एक दूसरे का वो राइट अप भी रह जाएगा, तो it will be nice. Okay, so today we'll conclude the session over here only with prayer. Straight your spine, close your eyes. सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु Kaschit dukhavag bhavi. Om Shanti Shanti Shanti. Rub your palms. When it's little warm, gently attach your ball and stick. And gently. Thank you. Thank you.
Thank you, sir.
Thank you.